So we're going to go ahead and get started. Before we begin, if you have any technical issues throughout the session, please make sure to submit it in our chat feature. And if you have any questions for the presenter, please make sure that you submit it in our Q&A feature. If you do have questions after the session, you do have the ability to submit them using the submit question form on our website. And that link will be in the chat momentarily. So this session is contracting updates. We're really excited to go ahead and get started. As a reminder, this is being recorded and it will be on our website in the coming weeks. And after this presentation is complete, we do have a poll. So if you'll just stay on for a few more minutes and complete that for us, we'd really appreciate it. So Liz, I'm going to go ahead and hand it over to you.
Thanks, Sam. So I am Liz Powell, the Assistant Director of Contracting in UNC's Office of Sponsored Programs. I'm really doing much better about saying sponsored programs instead of sponsored research, but I may slip up during this presentation, so please forgive me. So we'll go ahead and get started in talking about contracting updates. So the first thing we'll talk about is updates to OSP contracting. So about a year ago, we decided to expand contracting. We originally had 2 industry contracting teams. We decided to expand and to make it a contracting team. So under me, we have 4 teams. We added 1 new team, which is non-industry. We brought over the subaward team from another AD to myself. And so we have 4 contracting teams, 2 focused on industry and 2 focused on non-industry, and non-industry including all of our outgoing subs. So here is an organizational chart. We have a contracting coordinator that supports the industry teams and our Alice submission portal, Sandy Florence. So if you email the inbox, she's likely the one that's responding. We have 4 contracting team managers. Kim and Bree are the non-industry managers, and Eric and Angela are the industry managers. Eric's team focuses on clinical trials and outgoing site agreements, and Angela's team focuses on non-clinical funded research with industry, as well as data sharing and collaborations. So you'll notice that we are almost fully staffed. We are in the process of hiring our last 2 vacancies, one on Kim's team and one on Eric's team. So we do have a lot of new names, new team members, and we're really excited to have everyone on board and get fully staffed, and so that we can continue to provide this contracting service to campus. So this is the question of the year. Where do I submit a contract? I get this question a lot and I'm happy to answer it. I do think that this presentation will provide you a good place to start to help figure out where you can submit what. Some of the things that questions to ask are, what type of agreement do I have? Does it come with funds? Does it not come with funds? Are the funds being paid to UNC? Are they being paid out of UNC? What is the intent of the document? Sometimes we'll have agreements that say material transfer agreement, but it really is a clinical trial because they're transferring material to UNC for us to provide to our subjects. So the intent of that document is for a clinical trial, although the title is something different. So we really look at what the agreement allows us to do or what we want to accomplish with the agreement. Who are we contracting with, or who is the sponsor? That is another good question to ask. So is it an industry partner that we're working with? Is it a federal partner? Is it nonprofit? Is it something for an investigator-initiated trial? So for investigator-initiated, there's lots of different ways that an industry partner can be involved. Are they providing products, just funding, just the product? And so those types of questions are good to ask. So these are the main contracting systems for sponsored projects. I don't know if I have it in this presentation, but if you go to contracts.unc.edu, that is a website that has information about all contracting systems on campus and groups that do contracting. Today, we're just going to focus on those that relate to sponsored projects. So for us, at OSP Contracting, there are three main ways to submit a contract. CRMS, which is not a contracting system, but it does allow you to get to Alice from there. And I'll go into more detail about why we go through CRMS to get to Alice. And for those of you who don't know, Alice stands for a look into contract execution. And we also refer to her as a little old lady because she takes naps around 3 o'clock in the afternoon. Almost every day we have messages like, is she working for you today? No, she must be taking a nap. And then we have Ramsey's, obviously, which most people are familiar with. It's not necessarily a contracting system, but it is a place to submit an IPF, which is essentially can be used as an agreement request. So CRMS, I think it stands for Clinical Research Management System. I will say that there is I get a lot of questions about when is CRMS going away with the implementation of Encore. It is still live. It's still used for other things besides the interface to Epic. So we are still using it right now. If you have a confidentiality agreement relating to a clinical trial with an industry sponsor, you can go into CRMS, create a CRMS record that provides all the study documentation, study information that you have from the sponsor. I know a lot of times they don't give you the full information until that confidentiality agreement is signed, but you submit the information that you do have, and there's a link within the system that says submit agreement request, and you can click there and it takes you to Alice to complete the submission. The reason it's useful is that CRMS is used for other compliance pieces. So we're hoping to avoid you having to duplicate entering information. We know that there's a lot of duplication with IRB, Ramsey's and all of that. So it's just one way that we try to eliminate that duplication. And then, let's say we execute the CDA, the PI and study team decide that they want to move forward with that study. They can use that same CRMS record to submit a clinical trial and then related agreements related amendments and subcontract. And CRMS is used for industry sponsored or IITs with industry support, drug and/or funding. Alice is used for a lot of things. There's more information on our website. This is not an exhaustive list, but you can submit CDAs not related to a clinical trial. Anything that's unfunded can be submitted into Alice. And the reason I point out unfunded versus funded is because funded eventually has to have a Ramsey. If something is funded, it has to have a Ramsey's record anyways. And so if you have something that's not a clinical trial that has funding, you would submit directly into Ramsey's and we create the Alice record so that you don't have to duplicate. I know there's some confusion out on campus about having to submit both in Alice and Ramsey's. We try to take care of that to avoid duplication for you all. Data sharing agreements, DUAs, collaboration agreements that don't have funding, MTA for materials to be used in humans in clinical trials or for which PHI is being exchanged. If you have questions about if an MTA should come to OSP contracting or go to the Office of Technology Commercialization, please feel free to reach out to our general email box and we can work with OTC to figure out that, because it can get tricky. Master agreement, so master CDA, CTA, DUA, sponsored research agreement, etc. And then amendments for any of those that are listed. So Ramsey's, there are things that you submit only in Ramsey's, and I qualify only in Ramsey's because, again, all funded agreements must eventually be submitted in Ramsey's for project IDs, but the timing is different. So if you have an industry funded CTA that you submit through CRMS, in order to get a project ID, you have to eventually have a Ramsey's IPF, but that's more formality to get the project ID and can be done at the end. Whereas for non-clinical industry clinical trials or other types of agreements, they start in Ramsey's. They will be shifted over to Alice internally and then back to Ramsey's for project ID creation. So proposal submissions, obviously federal, nonprofit, or any competitive proposal or renewal, funded agreements with industry that are not industry sponsored or supported clinical trial, and teaming agreements. Teaming agreements are always handled by the sponsored project specialist because they relate to a proposal. And I did a presentation about a month ago and had a lot of questions that were submitted. I did the presentation on this topic. And so I just took those questions from that presentation that we get asked quite frequently. And so we can talk about a few of the frequently asked questions. Is there an average timeline for processing agreements? I got this question in the last sub-agreement symposium presentation. My answer is I don't like to answer this question because there's so many variables. Complexity is a variable. Workload is a variable. As I stated, we had a lot of vacancies. We're filling those vacancies, but it does take time to get individuals trained. And so workload can be an impact on timelines. Again, incomplete information in the submission can delay processing times. So we do have a goal internally that we like to shoot for, but once we get out our initial draft or initial red line, it's really out of our control as to the other party is how long they take to review or respond to us. So I don't like to give a timeline. And there's so many different types of agreements that, CTAs tend to take a lot longer than say a CDA. I will say that we try to get CDAs processed fairly quickly because those do have tighter turnaround times for getting those that confidential information. How do you get access to the systems? Typically, you get access through your department. If you have issues getting access through your department, you can reach out to OSP Help, and they should be able to figure out what needs to be done to get access to the ORA systems. If you realize that you made a mistake when submitting, how do you correct that mistake? There is no way to go back in and fix it. What you can do is email our general email box with the reference ID number or the ALICE number, if there is one generated already, and just provide information about what needs to be updated, and we can fix it on the back end. And who can you contact if you need help? You can always reach out to me. Also, OSP contracting, I believe, is at unc.edu is the main email address, and you can also use that to get information. We filled a lot of questions through that. You can also email those sponsored programs at unc.edu is another way. They'll refer it to us if it's related to a contract, but we will, it'll get to us eventually. So we have the new email, the main OSP inbox, our contracting website, the UNC contracting website. I think someone had a question about that earlier. That talks about all contracts across UNC, and our new, the main OSP website that does have information as well. And I think it's time to open it up to questions.
Yes, it is. And we currently have two. So the first one is, I know that we have to submit to ALICE via CRMS, but is there any way to also search in ALICE in case we are not on the original CRMS permissions? ALICE always tells me to get off her lawn.
Yes. Email the OSP contracting if you know that it's in CRMS but you don't have access to the record. You can also submit directly in ALICE and then email us to say, hey, this record goes with the CRMS. When it's submitted through CRMS and we pull it in on the admin side, it has a direct link to that CRMS, but we can manually add it if you know about it, or you can put it in the notes to say, hey, this is submitted directly into ALICE, but I don't have access to that CRMS record. Here's the CRMS record, and we can manually add it. And I believe, Sandy, that we can manually add you to that CRMS record, but we can test it out next time you come to it. Yeah, amendments as well.
Great, thank you. Another question is, will Encore be replacing CRMS?
I don't want to speak for, I believe Chris Nelson is leading the Encore initiative. I don't want to misspeak, so I'm not going to answer that question. I think ultimately, yes, but what does that look like? I don't know, and timing, I don't know. I think we still use CRMS for certain things. I want to say scheduling at CTRC and potentially pharmacy and some of the other compliance, or IDS and some of the other compliance pieces. So I think eventually, yes. Timing, I don't know.
Okay, great, thank you. And then another question is, if you're new to the university, not familiar with these systems, where can you go for training and or instructions?
I'd say the OSP website is a great resource. I know there probably is more in-depth training on Ramses. I don't know how much in-depth training there is on Alice, although it's pretty straightforward. There are instructions on where to submit what in Alice. As far as CRMS, the main people that should be using CRMS are probably more closely related to the study team and more clinical research side. And so I believe there is training put on by NC Tracks and the NRP potentially about for new clinical research personnel. And I believe they go into more of the CRMS piece.
Awesome. Thanks, Liz.
Thank you.
So it doesn't seem like we have any more questions right now. So thank you, everyone, and we will see you in our next sessions.